A very good evening once again. You're watching News 9 Facebook Live with me, Adarsh Wepachedu. The wait for a vaccine continues, but it is certainly around the corner. So much so that the Indian government is at this point in time in the process of drafting out a plan for the COVID-19 vaccination drive expected next year. Going back a little, it was on the 15th of August that Prime Minister Narendra Modi had announced the ambitious NDHM program, or the National Digital Health Mission. Now, as for the health program, everyone enrolled with the mission were in fact supposed to get a digital health ID that will enable smooth access to medical services. Cut to present, there is a question looming in a few quarters. What if I don't have a digital health ID? Will I still be able to get myself vaccinated for coronavirus? In the latest, Union Health Secretary Rajesh Bhushan sought to clarify this very matter. He said that a digital health ID would not be mandatory for immunization against COVID-19. He further reassured that those who do not have health IDs would not be deprived of COVID vaccination. Now, to tell us more about how this could impact our vaccination program, we have with us Dr. Vivekanand Jha, a public health expert from Delhi, joining us on the phone line. Many thanks, sir, for speaking to us. How important is the IT backing when it comes to the vaccination drive, and how would you see data privacy concerns around the whole process?
Thanks for inviting me. So these are important issues, and they stem from the fact that India doesn't really have any well-set or established program for vaccinating adults. Now, in the context of COVID, it's really important that every single individual who is vulnerable to COVID gets a vaccine, because we know that even if a small number of individuals are not vaccinated, they have the potential to spread the infection to others who might be vulnerable to it.
Yeah.
So while ID is useful in order for us to keep track of who's getting should be prioritized is that the vaccination reaches everyone, irrespective of what form of ID do they have. Clearly, there are concerns regarding data privacy with various kinds of data sources, including the data points that are used for verifying identification. And it's really critical that all the regulatory agencies, including the governments, make sure that any concerns regarding data privacy are addressed appropriately.
Right. Doctor, while we speak about how we must ensure that every single citizen across the country gets vaccinated, with that in mind, how crucial is maintaining an electoral or poll-like scenario for vaccination where multiple IDs are prescribed beforehand? There are a few voices that are suggesting that, only the health ID should be the way to go about it to ensure things are more systematic. As a public health expert, what is your take?
I think this is not really a public health issue. This is an administrative and a logistic issue which should be addressed by people who do these kind of things. As a public health expert, as I said, my concern is that anyone who is vulnerable should receive a vaccine within a reasonable period of time. We need to have rules and laws that are equitable, that are transparent, and that are applied uniformly. We really should not be getting into a situation where certain few who are privileged enough to have the kind of health ID that will allow them to get the vaccine faster should be prioritized compared to those who don't have such IDs.
Correct.
So it's really important that we address this issue first before going into before addressing the issue of what specific ID. I think that is a matter of administration or logistics which needs to be figured out by people who manage that process.
All right. Doctor, lastly, how crucial will the upcoming vaccination drive be, particularly for the enhancement of NDHM and, giving more value to the digital health ID itself?
This is not directly linked to digital health ID. I think all
But it's an opportunity for the NDHM to try and better things at their end. Can we say that?
Oh, yeah, of course. I mean, all initiatives, including NDHM, should take advantage of any opportunity that comes their way to improve their processes, their systems. Coronavirus is definitely one of the worst things to have happened to humanity in a century. But there are a few opportunities for us to improve our processes, one of which is to, of course, improve our digital health processes. Digital health is what we should do. But it should be done in a manner that is, again, sensitive to population needs It should not be coercive. It should not be done in a way that direct people the services that they need. That's really the most important thing. So any improvement that takes place should take place in a context of efficient delivery of services.
Okay. So lastly, Dr. Vivekanand, the government has made it clear that all forms of IDs, at least many forms of IDs, can be applicable in order to get one inoculated or vaccinated. So do you think that's a step in the right direction? And again, what would you have to say about universal vaccination? Are we really approaching on that path? Are we treading on that path correctly?
I think universal vaccination is only a goal to aspire to and is unlikely to be achieved in a relatively short period of time. We are a country of 1.38 billion people. Yeah. We have learned from the smallpox and polio successes that it takes years to really run a successful vaccination drive. We do have a program, we have a framework to say that it can be done, but we need to be patient, we need to be careful, we need to have the processes in place, we need to exploit all possible avenues, for example, as was done during the cases of polio vaccination and so on and so forth. So we should not be restrictive, we should be liberal, we should identify individuals, and I would say that one of the things that we should not forget is to try and be opportunistic.
Okay.
So wherever there are opportunities to get people who are vulnerable, get them there and provide them with vaccination. So in a way, rather than to control the availability of vaccine, making the vaccines as liberally available as possible would be the way to go. However, we have to realize that we are constrained by the availability of vaccine. India will need, very, very large number of doses of vaccines, which are not going to be available right away. And that's why, as I said before, we need to develop transparent, equitable, and appropriately enforceable priority criteria of who gets the vaccine first and who gets followed, with the eventual goal of leaving no one out of this ambit of vaccination.
Right. There's already work being done on that front as to who should get the vaccine first and how quickly. Many thanks indeed, Dr. Vivekanand, for joining us and for sharing with us your insights on how the government has now said that health ID is not mandatory for you to get vaccinated. Any kind of a government ID would also do. Yes, we will wait for a confirmation from the government end as to what are these other IDs that we can really make use of. But bottom line really is it's an opportunity for the healthcare infrastructure, for the health system in the country to pull up its socks, ensure that this is again a stepping stone just in case if we were to face another pandemic of this sort, we'll be better prepared. So yes, all eyes will be on the healthcare infrastructure to see as to how they go about this mammoth task, this Herculean task of vaccinating the entire population of the country. If you've liked the information that we've shared with you, do not forget to like, share and subscribe to News9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.